Welcome to Dr. Freedom, where we give you the strategies, mindset, and tactics on how to elevate your practice and your life. I'm Dr. Shitel Patel. I started my practice in a Starbucks over 7 years ago, and I built it brick by brick to a multi-location practice with an aesthetic OR and a software company. I'm here to give you the secrets to unlock that time and freedom for you. Today, we're going to be talking about personal branding. Now, why in the world would a doctor be talking about personal branding? Well, they did a poll to see where is personal branding the most important for the common person. That means you and I, right? Where do we think personal branding matters the most? Is it an athlete? Is it a celebrity? Is it in politics? What is it? They found out that 60% of people think that a physician, especially a surgeon, it is extremely important for personal branding to be important because safety and trust. And that is what branding revolves itself around. So let's talk about that in terms of, the actual personal branding that it takes to be known for what you are known for. It's one thing to go through the schooling, all the years, right? From medical school to the training afterwards, to residency, to any fellowships or anything else that you do. Well, how does that get showcased to the public, right? In terms of, hey, how do I know this person's good or not for what I'm going to them for? And that's where branding comes in place to say, what are the core values? What do you want to be known for? What are you good at? And then how can you translate that to the messaging, the other things that go along with the brand? And it's not just logo. It's not just some fancy colors and there's other things that, you look at and say, oh, well, it just looks so chic or it looks so cool or this and that. It's not just about that. It's actually about the identity, the messaging, the core values that actual provider and that doctor and that facility and the people in it all live by in what they do. And this starts from the top down, from the doctor all the way to the front desk to say, hey, how are they answering the phones? How are they doing the next thing? What is important for them? Is it patient care? Is it the conversion? Is it money? Is it respect? Is it power? All these things kind of come in play to say, hey, what do we want to be known for? What type of brand and company do I want to have? Is it high volume, low quality, high quality, low volume? Which one of these things can you do in a safe manner to practice medicine and deliver the care that you intended to, right? It's not being overwhelmed, running around and doing the things that you may not be the greatest at. And that is the truth. And that is something that's hard for especially surgeons or people that have gone through years of training to say, okay, well, this is the end all be all of I have to be responsible for all these different things within my field. Well, the truth is you don't, right? You think about aesthetics and plastic surgery. There are people that specialize in the face. There's people that specialize in the body. There's people that specialize in the breast. There's people that specialize just in the butt. There's all kinds of different areas that you can subspecialize in to be the best at. Even noses, right? There's people that are world renowned for just that. And that is part of their brand. But it's identifying what you love to do and then building around the structure to say, these are the relationships that are filled both ways. Not only the bucket for our patients, but the bucket for ourselves as practitioners, as providers, as staff to work in those fields, right? Sometimes you find certain people want to work in a field because of what it is perceived as. And what I mean, the perception is the perception of, oh, this is bougie or this is highly respected or highly regarded, right? In terms of orthopedics, neurosurgery, plastic surgery, all these type of things, and dermatology, right? In terms of the oohs and ahs of the ability to change and transform our patients' lives. But at the same time, do you have passion that lies there? Do you have the emotion to connect day after day in terms of what you believe in, what you're passionate about in terms of why you do what you do for the people that have the why to need the change. And that is the critical piece to say, can I tie that together in terms of my brand story, in terms of the brand of who I am outside of the little box of just saying this is what medicine is? Because medicine is just a piece of the puzzle. There's the delivery of it. There is the compassion, the empathy, the care, the conversations that happen. And even if you're tired, even if you have to, you're there late, or this other, like there's something else going on, you still have that compassion, that empathy, because you're passionate about the skills that you got trained to do and being able to deliver them to the people that need them in the right time. Now, back to the brand. It also comes down to your tone, how you talk, the way that you talk about things, the way that you talk about your patients, right? It's not only the things that you say to them, but it's also the way that you talk about them. And that is the other kicker, right? In terms of some of these specialties, and some of the physicians will speak to their patients in one way and speak about them in a different way. And it shows, right? In terms of you can't hide your thoughts and your feelings and your expressions. When it shows, if there's a certain patient population you do not like to treat, I would just stop treating them, because they know. They know that you don't want to treat them, or you would prefer to treat a different patient population. And if that's the case, you need to sort that out for yourself. And that's where you got to dig deep, do the hard work, look in the mirror to say, what is my brand? What am I passionate about? And again, this can change over time. It is not something that is the end all be all to say, if I commit to this now, will I never be able to change this?
All right, let's get to it. What does AdVital do for your aesthetic practice or med spa? Our current clients are making an extra $60,000 to $65,000 to their bottom line every month over month, because they're able to nurture their current patient base and also amplify their qualified leads. Now reach out to AdVital to learn more.
And that is the fear that creeps in. The fear of, I'm stuck doing the same procedure a million times in a row. Well, now if you love it, you're no longer stuck. You're free and privileged to do those procedures a million times in a row, or the variety of procedures, over that time point that you're looking to practice medicine. All these pieces go back to the messaging that you need to deliver. Now, part of the messaging starts with the first interaction, and that usually is your front desk. So it's super important of how you hire them, what you have them say, and how they feel about the practice. And that is super critical in that first piece of interaction. Taking it one step further, what other pieces of content are you giving your patients in terms of your brand? That's where, our software of AdVital came into place to say, hey, there is a piece of branding that's missing in these physician offices, and especially in the aesthetic space. We figured out that it was that first message to get them to know who you are, but not only who you are, but why should they be interested in you? Why should they choose you? What makes you different than the other people down the street, or the other people that are competing for the same market share? So these things are super critical to say, okay, do I know what that is? Can I write that down on a piece of paper? If I ask my entire staff, will they say the same thing about our practice? Or will they say different things? Have we even had the discussion? And so that's why it's super important to have your people on board to say, these are our core values. Is it patients first? Is it delivering the ultimate quality, the ultimate product, the best of the best? Are we, what are we known for? What do we want to be known for? And how do we get there? Like, how do we align that mission and values and that goal to actually get there? It's not just the vision, but it's the mission that tie it together to say, this is what our practice is about. This is who we're here to serve. And this is what we are here to do and be for. Now, if you have all that stuff locked in, then what's the next step? You have to get that message out there. So the first step is like, hey, this is what our practice is about. Everybody in the practice knows, and this is how we're going to implement it. Getting everybody on the same page in terms of the conversation, the messaging, each one of these extra pieces that kind of go in to say the soft touches for someone to know that you're authentically who you say you are. Now, that can be different in terms of what you put out there in terms of social media. And that's a critical piece to actually think about, to say, is the content that I'm actually putting out there who I want to be known for? Is it outside what viewership might be looking for? Or, is that more important in terms of the fame of what we do? Those are deeper questions. And each practice needs to figure out what the answer to those are. Once you figure that out, then you can actually come up with the next part of how that fits into marketing, the strategy, the plan of how your brand needs to grow and scale in the area that you're in. And as a physician, it's super important to protect your reputation. And that's why people look at reviews. They look at your before and afters. They look at, how you interacted with patients, what the stories are, what the testimonials are, right? There's a piece of that that's authentic because it's in somebody else's terms and words. That also goes for your staff. Your staff will also talk about your business in different ways. And that is where the most important part of knowing what your brand is actually what people say about you when you leave the room. And that's not my quote, that's Jeff Bezos, right? Saying that's what defines your brand. What do they say about you? What do they say about your compassion, the care that you delivered, the results that you provided? What do your reviews say, right? All those things kind of play a role in terms of what builds that brand. Now, that brand can go through its ups and downs in terms of the time points. And it depends on who you have in the critical positions of saying front desk, the back office, the personnel, the people will actually make the connections and make the story come alive. To say, this is who I should go to for this type of procedure, and I'm willing to travel, I'm willing to do all these things, I'm willing to pay more because I'm getting the quality value from the actual thing that I'm looking for. And that's the brand of what it takes to be a physician in this day and age, right? That is what people are looking for. They're looking to know, like, and trust you. They're also looking for safety and security. How do you portray safety and security? Well, it's a repetitions of the actual thing that you're doing. It's not something that you can say, hey, I'm safe and we have a secure facility and we do this and we do that. That's not it. It's what other people are going to say about you, right? You think about the brands out there that have, stayed true and tested time, right? The Apples, the Teslas, the Sonys, right? They got known for a specific quality, and that's what people pay for, right? For a Louis Vuitton bag. There's all these different associations that people know of what to make with the actual piece of the brand and the product they're willing to pay for. And it may cost the same to make two different products, but if one has brand recognition, a perceived value, people are going to be willing to pay more for it and appreciate it more. And that's why branding, I think, matters more now than it ever did before, especially in the practice of medicine, because people have realized they have options. They don't just have you as the only option to go to. And once people have realized that and they can choose, now they're going to vet you. And they're going to vet you by what you've done and how you've done it. How you've treated the people in your practice, how you've treated the patients, and how you've treated everyone before them. And that is where the compilation of what you do is building that brand story over time to get the accolades and the recognition that you want to have in your practice this day and age. And that is the whole point of where a brand is just a necessity to actually provide leverage for your business to grow and scale as well, because that's something that nobody can take away from you. It's not like they can just shut down your ad account. They can't, wipe you from YouTube or this and that and whatever. Your entire brand story will be showcased on your website. And that is one true piece to say, okay, this is who we are, and how we treat everybody that has come in our doors. And I think it's super important. And so that is my tip and trick of today to say, hey, branding is super important. And it's not something that can be overlooked. It's not something that can be neglected. It has to be, customized and nurtured and pretty much put together to say, you have to know who you are and what you want to build to be able to build the brand of what you want to put out in the world for your practice of medicine. That's all I got for you today.
Thanks for listening to Dr. Freedom Podcast. I hope you found some value in this podcast, and if you could hit the subscribe button and share with a friend if you found this content valuable.